Why? We're working on a better setup. So someday you won't have to see Miss Nicolie Ravioli
come around the side.
all the way over. Okay. Hi.
Hello. Welcome back to another episode of the Boss Ravioli Queens podcast with your two favorite caregivers.
Boss Lady Amy.
Nicolie Ravioli. Hello.
Okay, let's get the shameless plug out of the way. Dink. We're getting so good at that.
We are. First bump? Fist bump. Brain glitch my time. Got it. Got it. Oh.
Okay, so, hi, hello, if you're new here, welcome. We're the Boss Ravioli Queens, your two favorite caregivers. If you're not new here and you're wondering what happened, we used to be 3 caregivers, and now we are 2. So we talk about healthcare, caregiving, trending topics, how they relate to our little healthcare corner of the world. We try and stay relevant, funny, informational, educational, and we advocate for those who can't advocate for themselves.
And or need help.
Yeah. So we're currently going through some technology things.
Mm-hmm.
So usually we release an episode every Wednesday, but due to some issues, it might not be Wednesdays.
Tuesdays, Wednesdays, or Thursdays. Possibly even Friday, but not usually.
TBD. We do a video every week. How about that?
Yeah. Yeah.
So currently we are not releasing audio-only versions of our podcast. So you can go back and listen to our old episodes anywhere you listen to podcasts other than Apple. However, you can go back and watch all of our old videos, and then also you can stay up to date with all the new videos that we release. We might go back to releasing audio versions at some point, but as of right now, it's just there's a lot going on and it's up in the air. But yeah,
Yee.
that's our podcast. So come on this journey with us. Think.
We're getting so good at that.
I know.
Okay, so today's episode is called Cayley's Story. Before we get into it, the people involved in the story are my friends. They gave me permission to use their names. So before anybody comes at us for that, we have permission. I have the text message receipts. So backstory. Maddie and Cayley are a couple. They are engaged. They were planning to get married, I believe, in the summer of this year. Don't know what's going to happen with that because political climate is shit right now. So it is what it is, and we will see where things go. But the reason this episode is called Cayley's Story is because Cayley is a type 1 diabetic who also was diagnosed with CHS a few years ago. For those of us that don't know what type 1 diabetes is, that is insulin-dependent diabetes. And then CHS, I don't remember the abbreviation, but basically what it is having a very, very, very bad reaction to THC.
So I forget if the first word is cannabidiol or cannabis, I don't remember. But then the H is hyperemesis and then the S is syndrome. So basically cannabis hyperemesis syndrome. Where if you don't know, hyperemesis is extreme vomiting.
Uh-huh.
Yeah, because of a poor reaction to THC.
Yeah.
So, I had never heard of CHS until Miss Ravioli had brought it to my attention and told me, like, what was going on with her friends, Maddie and Cayley. And just a very, very, very quick Google search will tell you that it's much higher in people with diabetes because something about their bodies mistake it for DKA, which is diabetic ketoacidosis, which basically happens when your blood sugar gets so high that your blood starts to become acidic, which can cause very, very severe...
also vomiting.
Yeah, vomiting, but just like
super intense, like nerve pain as well, I believe, and then it can even cause like stomach ulcers and stuff like that. So,
yeah.
I had a friend years ago who was in and out of the hospital quite often for ketoacidosis, but now that I'm thinking back about it, he smoked a lot too. So it also could be CHS for him.
And was misdiagnosed.
Probably. I mean, he is also a type 1 diabetic, but he was just born that way. I'm not sure if Cayley was born with it or if it developed later on in her life. But anyways, my friend that had ketoacidosis and was in and out of the hospital like a lot in high school and a couple years after, he described it like his whole body was like on fire. Like his veins were on fire. Doesn't sound very fun to me. And then that also sent him into gastroparesis as well. I don't know if you know about that. Anything about that? I know very little, but I still know.
Isn't that when your like parts of your GI tract are like paralyzed?
Yes. When that also causes extreme pain in your stomach area.
Mm-hmm. Yeah.
So yeah.
Fun stuff.
So currently, Cayley is back in the hospital. She had a slip up, she smoked or something, there was THC in her system, and she's back in the hospital. But the doctors haven't been listening to Maddie, who has been there through everything regarding her like DKA and CHS diagnosis and all of the things. Maddie is actually the one who advocated for her when they lived in another state. And got her diagnosed with CHS in the first place. So, the way Maddie explained it to me is that opiates are really, 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 really bad for her CHS, for Cayley's CHS. They cause more pain and more vomiting, which does make sense because Cayley has been unable to eat for the last 5 days. And opiates cause nausea and vomiting on an empty stomach. So that tracks. Like, it makes everything worse. The doctor didn't listen to her for 2 days, 2 full days, and then finally listened and put Cayley on some muscle relaxers. There was actually, like, kind of like a cocktail that Maddie recommended that they use. Again, doctor didn't listen. Is what it is. But then she started having heart issues as well, and her heart rate was sitting at 130 beats per minute for a while, it sounded like. They gave her meds to bring it back down. That also took a while, and Cayley just kind of really isn't doing well right now in that aspect. So they stopped all of her pain management, which makes 0 sense to me because when you're in pain, your heart rate goes higher anyway. So in order to combat the heart issues, you would think that they would want to keep her as calm as possible while they're trying to figure this out. Because Cayley also does have AFib. Oh boy, it's atrial fibrillation. Fibrillation. That. God. So basically that's when your heart gets tachycardic, which is a fast heartbeat. It's not like a constant state of AFib. AFib literally comes in spurts. Like, it's not just constant heart rate high. It's like you'll be fine for a while and then you'll get an episode here and there.
Yeah, you can go into remission for a really long time with AFib.
But then, obviously, when we get older and our body systems have to work harder, then it'll resurface. And at that point, they'll probably try to insert, like, a defibrillator. Mm-hmm. I would hope that people know what that is, but if you don't, it's literally, like, a little machine that they put inside your chest. And it keeps your heart going, like, it shocks your heart if it goes into AFib to regulate your heartbeat.
Yeah.
So, yeah. Cayley's on the Hot Mess Express right now, which sucks. And it really sucks that the doctors aren't listening to Maddie because, again, Maddie has been there for her through everything, all the way from the DKA to the CHS diagnosis, and is the one that helped her get diagnosed in the first place.
Mm-hmm.
So, with that, we're also going to talk about advocating, because as caregivers, if you've watched the other episodes, you know that we advocate heavily for our residents, because we have to. We are the voice that they don't have.
Mm-hmm.
So since they can't speak up for themselves, we have to advocate for them in every way possible, whether it's a care team, a doctor, a house issue. Like, there's a lot of different things on the spectrum that we can advocate for, but one of the main ones is healthcare. Their healthcare.
I'm sorry. Ignore my pets. They're both idiots. One's currently digging through his hoard of tin cans, and the other is playing with a stupid little fake coin on the floor. So, just ignore that. I'm sorry.
Feel free to jump in anytime. I've been doing a lot of talking.
I'm sorry. My pets are so stupid.
That's fine.
Okay. Couple things. First of all, so if it wasn't obvious before, obviously Cayley has a
It's okay, just keep going.
Obviously Cayley has a past with addiction and things like that. And so I'm gonna assume probably that part of the reason that the doctors weren't listening is because of that. But then on the flip side, it's really interesting to me how they were so quick to just like give her opiates and just like give her all these different medications.
I left that part out. So upon arrival, she was given fentanyl and morphine. And if you know anything about D-rug usage, downers, when used closely together like that, even in small doses, can literally unalive you.
I mean, that's, we did an episode on this like way back in the beginning when we first started this. And we talked specifically about how that is how you end up passing when you're on hospice. Mm-hmm. Is that you don't actually pass from the disease that you have. It is the morphine and
lorazepam
and haloperidol combination that they keep giving you, and that's eventually what takes you.
Because the morphine relaxes you enough, makes your lung function a little better actually because you're so relaxed, and then the lorazepam combats the anxiety that you get from the morphine because generally you're not eating and you're nauseous and you just don't feel good.
Yep. And so that's, basically what happens is that eventually you get to the point where, you know, your disease has progressed where your body's gonna start shutting down. You don't need food anymore. And then eventually the medication does its thing. And I mean, it's very, crude to say, but you end up just dying of starvation and an overdose essentially. Mm-hmm. But it's a much more comfortable way to go than what it sounds like. Mm-hmm. But yeah, and so the fact that she does have a history of addiction is like really crazy to me that, like I said, again, probably the reason for a lot of the poor treatment is because she has that addiction past, but then also the fact that they were so willing to just give her opiates right off the bat is really crazy to me.
Well, also CHS is such, like, it's common, but in the medical field it isn't well known in the medical field for some reason, even though it's very common in people with diabetes.
Yeah, which
I found absolutely nuts.
Like I said, just a really brief Google search. Like, I really don't know anything about CHS other than just like what I've been told. And like I said before, I had not even heard of it until Nicole started telling me about this stuff. Just from a very brief Google search, it said that there's been only 8 documented deaths related to CHS since 2004. But honestly, that number is probably higher, but I'm assuming that those people that passed away probably had other
underlying conditions.
primary diagnoses or underlying conditions that the doctor maybe wasn't aware of the CHS, or they didn't take the cannabis use into consideration, and they probably were just like, oh, it's whatever, like,
Yeah.
And so I'm assuming that it probably causes more complications than we know, which I think can be said just about cannabis use in general. Like, yes, it's a very good thing. It's a plant. It's natural medicine. But like anything, in certain people, there's going to be certain reactions that maybe our bodies just weren't. For some people's bodies just weren't meant for that,
Yeah.
Like, it's too much of a good thing for anybody is a bad thing.
And like, as we've said multiple times, one size does not fit all. So like like in, say, mental health diagnoses, something that works for me for my anxiety might not work for you for your anxiety. It's a trial and error process. It's not the same for everybody. And the same goes for drug usage. So it definitely affects people in different ways. I know a lot of people that cannabis helps, and I know people that it hurts. Like myself, for instance, if I were to partake in the wrong strain, it would send me directly into a panic attack. Doesn't matter how litty I get. Like, I could take one puff and it would just like skyrocket me into a panic attack. Whereas the other strain actually calms me down and like helps me sleep. So, yeah. Yeah,
and it drives me crazy when people are just like, oh, just do this. Oh, take this. Like, you don't know me. You don't know my medical history. What works for you isn't going to work for me.
Like, yeah, there's a chance that it could, but it's not a guarantee.
Right.
So overall, when talking things about medical diagnoses and what works for you, or dieting and what works for you, just because it works for you doesn't mean it's going to work for somebody else. Like, even me with my whole PCOS thing, like, PCOS is so weird because it's different for everybody. It's not the same in any one person. And what works for one person may work for me or it may not. That's why I have to go through this trial and error series to see what actually does work for me.
Yeah. And same here. I have fibromyalgia. We've actually both talked about that a lot in previous episodes where PCOS, fibromyalgia. And yeah, it's really important to do your research. Like, I've been on a ton of different supplements. I've tried a whole bunch of different things. You have to know what works for you. Like, when I was much younger, I had, I still do, but I had a plethora of mental health issues at the time. And, like, people would tell me all the time, like, I couldn't sleep. I had horrible insomnia and I literally couldn't sleep. And people would tell me all the time, take melatonin, take melatonin, take melatonin. Like, trust me, I tried. I was literally taking like 20 milligrams a day and I was getting like 2 hours of sleep a night. If that. I remember one time I got like between like 3 days, I think I got a total of 5 hours of sleep.
Relatable, but ew.
Yeah, it was horrible. So like, just because something works for a lot of people, like the vast majority, it doesn't mean that it's going to work for you. And, the same can be said about cannabis usage. I mean, not to say that I don't think people should use it or anything like that. I'm certainly not against the use of it, but I just don't think that we should be telling people, oh, you just go do this, try that. Like, you don't know how they're going to react.
Nope.
Honestly, after learning a lot not a lot, more about CHS and just learning what it is. You know, like I said before, it's a really interesting disease, I guess you could call it, disorder. And I really do think that there are a lot more people that suffer from it. And again, because of underlying diagnoses or other things like that, they probably just didn't know and chalked it up to something else. And then, of course, you have those people that probably, the more they get nauseous and the more they vomit, they'll probably smoke even more to try and combat that.
Yep. Well, it's just, it's crazy because, like, Maddie's told me so many times that every time Cayley goes into the ER or the hospital for something like this, automatically it's assumed as DKA. But Maddie knows the difference because she's been with Cayley long enough and seen enough episodes that she knows what it looks like when she's in DKA or when she's in a CHS flare-up.
Yeah, it's really crazy. Again, very quick Google. I was just reading a little bit about it, and I read that the come down time from the flare-up can literally take anywhere from 48 hours to 6 months. That's insane.
But if they're on the right meds, like, you know, the muscle relaxers and, like, the combo that Maddie had mentioned, that has worked for Cayley religiously. But this one doctor just won't listen to her. And now they're trying to discharge her today, and send her home with one medication that may or may not work.
And so another thing that we were talking about briefly before we started recording, the fact that she hasn't eaten is insane. I know we touched on it a little bit, about how being pumped full of medications and not eating is only going to make you sicker. But they should put in like a PICC line or something to get her some type of nutrition, because that's crazy. 5 days is enough to put anybody into like a life-threatening starvation situation.
Right, and like the last time that this happened, I was actually friends with them for the last episode as well. And she, I think, spent about a week in the hospital and was just continuously vomiting blood because she didn't have anything else to throw up. Because she couldn't eat, and anytime she tried anything, it would just come right back up anyway. So for them to not send her home with a PICC line and IV fluids and like vitamins and nutrients and like the things that your body needs to get better is crazy to me. Obviously, like, they would have to educate Maddie on how to use all that stuff, because I don't believe Maddie does have that knowledge currently. Not many people do, unless you work in healthcare. But they can educate you. Like, my dad came home with a PICC line from the hospital at one point, and my mom had to learn how to do all the things because he was on an IV antibiotic. So what you need to do for that is you do, I believe you start with a heparin flush, and then a saline flush, and then the antibiotic, and then another saline flush, and then another heparin flush, and then you close it off. It can be confusing for some people, though. Like, that order can be really confusing in general. But what the heparin keeps your blood from clotting. It's an anticoagulant that you put through the line because obviously it's in a vein, or an artery, depending. It wouldn't be in an artery. Just a vein, right?
I don't know. Well, because the PICC line doesn't it go directly like to your heart?
Yeah, but it can be in your chest or your arm, though. It can be like anywhere there's a vein.
Yeah. So basically, a PICC line is it's like I don't know, it's about the size of like a really small IV.
But it's got like, it's a long tube, basically. So like, they have like that IV netting to secure it, and then tape that you can also put over it to secure it as well. You just want to make sure that it doesn't get pulled on at any point because number one, how, and number two, you have to put a new one in then.
Yeah.
Because if it comes out at all, you have to get it replaced.
So typically a PICC line is like, depending on what kind of infection you're fighting, it's usually placed somewhere like along your chest, and basically they put it near your heart so that you could get like close to a major artery, right? I think.
Are you sure you're not thinking of a port?
I might be.
I think you might be. Because PICC lines, I'm pretty positive, are generally like in the arm, upper or forearm.
I thought it was just your heart.
Again, that's a port. Google. You have a phone, mine's recording. I can't Google right now.
Google's free.
Anyways though, with external lines like that, when you come home you have to know how to take care of them, and obviously the hospital staff will educate you on that if it ever happens to you. But in Cayley's situation, they should absolutely be sending her home with a PICC line, because basically what Maddie said to me is she knows that it's going to be one of those situations where they send Cayley home. Cayley's going to wake up screaming and crying and probably vomiting in the middle of the night, and she's going to have to call an ambulance and send her right back in. And then they're going to have to start this process all over again, and that is freaking exhausting. It's not fun for anybody to have to do that with a loved one. So, as I've said, advocating is important, and Maddie has done a phenomenal job advocating for Cayley throughout this whole thing. Well, not throughout the entirety of the time that they've been together.
I was thinking of the portacath.
Yeah, I knew it. Y'all heard it.
So portacath it's literally like inserted. Basically, it's a line that goes straight to your heart, because they want the nutrients and all of the things that are getting pumped through to be distributed throughout your entire body as quickly as possible.
They also do that for cancer patients, because cancer patients have to go in for a lot of blood draws, and you can also get blood off of a port.
Yeah. Well, a portacath is different from a port, though. A port comes from your arm, portacath to your heart, and then PICC line is your arm.
You want to try that again?
What?
The port goes in your chest.
A portacath is what I'm talking about specifically.
It's literally the same thing.
It's not. Okay. Google said it wasn't.
Okay. Excuse us for a moment. But like the thing that I'm talking about for cancer patients is only inserted into the chest as well. I've seen it. I know.
It's a portacath. Today I learned that there's more than one type of port. Let's put it like that.
Okay. Yeah. Yup. I lost my train of thought. I know I left off somewhere with Maddie has done a great job advocating for Cayley throughout the entirety of their relationship.
Mm-hmm.
Because obviously with Cayley having these episodes and then thinking that it was solely DKA, like that was a problem. So that also goes to show you that advocating works. You just have to be really consistent, and sometimes you gotta be a bitch about it. It happens. Like, I've had to yell at doctors before, and I don't care.
Same.
As long as my residents are taken care of, I don't care what I have to do.
Same. I've been told that my rude behavior would get me kicked out of the ER if I continued. So.
Been there too.
But you know what? It gets results. Not saying that you should do it, but sometimes you have to.
If in a circumstance where a doctor is just not listening and being completely unreasonable and kind of a dickhead, absolutely be a bitch. If you gotta, like. Because there are some doctors out there who will actually take what you say into account the first time. That's a rarity, but it does happen.
I had one doctor that I'm pretty sure was like very new to the field, and
Those are like the worst ones.
I took my resident in, and I had told them up and down, up and down, up and down, we are here for routine UTI. If you don't know what that is, that's a urinary tract infection. We've done a lot of talking about this topic too, but basically, UTIs in older folks and cognitively disabled folks, it makes them weird.
Yep.
Don't know why.
They become not themselves.
Yeah, they
Very
just
abnormal.
do odd things, odd behaviors, just weird stuff. Yeah. So, you normally, if you notice a change in condition if you are in caregiving, and you notice a really sudden change in condition in your people, they probably have a UTI. Anyway.
Hold on. You should fill out an incident report, and you should also notify your management staff.
Correct.
And then from there, they will tell you that you need to get them to the walk-in.
Correct.
Or the ER, depending on the severity.
Correct. So I took this lady in. I told them up and down. I was like, look, she has a UTI. I know this lady. This is what she looks like when she has a UTI. It gets weird. She needs some antibiotics. We'll be on our way. They were like, hold on. They wanted to test for everything under the sun. And I'm like, you don't need to do that. She's got a UTI. I know she has a UTI. And the doctor comes in to do like his whole consultation thing, and he's like, well, it could be this, it could be that. I'm like, no, it's not those things. It's the UTI. And I tried to explain, like, I work with her every day. I know this lady. It's a UTI. Mm-hmm. And, of course, when he came back and he's like, well, you were right. It's a UTI. I'm like,
wow.
No. Really? I am shocked. So it was a very unnecessary visit. Like, it literally could have been 20 minutes. Like, all they needed was to do a culture and just give us some antibiotics. But yeah, we ended up being there for like 3 or 4 hours. And yeah, for them to just be like, wow, well, it really was just a UTI.
I also feel that it's necessary to say that it's pretty common knowledge that hospitals are corporations now. Mm-hmm. So if they're testing, generally it's going to be unnecessary things mixed in with necessary tests. Because then they get more money, because each test is a different dollar amount.
Yeah. And I told the guy, I was like, look, I know her. I work with her day in and day out. I was like, I know that you are very good at your job and all of the things, but I'm like, I assure you that it's not any of the things that you think it is. Mm-hmm. And he was like, yeah, well, we gotta be thorough. Like, I get that. I get you're doing your job, but I'm also doing mine. Mm-hmm. And I'm telling you right now, as part of my job, she's like, I know what it is. If I could prescribe her an antibiotic myself, I would. I would have saved us a trip. But unfortunately, I'm not a doctor, so I couldn't do that. Mm-hmm.
And also, over half the time, the nurses are the ones that tell the doctors what to prescribe anyway.
I know. Half the time, they're the ones that they already got the order on the computer and everything. They're just like, oh, I need you to sign off.
Yep.
That's it.
Mm-hmm. So I know that I've told this story before, but I'm going to tell it again because it's important. So I had a resident who did have seizures, but his grand mals were really, 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 really bad. And usually they would happen if he had either a UTI or pneumonia. Usually pneumonia was like further up on the list, like that was the most common reason for it. So I had a coworker who had taken him, actually I took him to the ER originally. They didn't do a chest x-ray. They did a urine analysis on him and sent him on his merry way. Said that like nothing was wrong. And no sooner did we get back to the house, second shift came in, 5 minutes into the shift, has another grand mal. Lips turn blue, over 5 minutes, like crazy. So I told my coworker that I would meet her at the ER. I was like, don't worry about it, take him up. If they give him the same doctor, let me know and I'll meet you up there. Well, lo and behold, same doctor. Same thing, same result. They didn't even do blood work on him the first time either. It was just the UA. That's it. And then they just sent him home and he's fine. No, he's not fine. So, my coworker called me and she was like, what was the doctor's name? So I told her and she was like, yeah, it's the same one. And I was like, I'll be there in 5. So I drove there after I was done with work and I met him in the ER and my coworker told me that it was literally the same thing. They were just going to do another UA and send him home. No blood work, no chest x-ray. So I looked at her and I was like, press the button. So she presses the button to get the nurse in the room. And I was like, I know this isn't your fault, but I would like a new doctor. I was like, my resident has not been taken care of, and just because he can't speak for himself does not mean that he doesn't deserve the same care that a normal person would get. I was like, I want a new doctor. I don't want that, I said colorful words, back in here. And so the nurse doesn't even request a new doctor. She tells the doctor that I requested a new doctor and he comes in the room. And I said, what in the actual F are you doing in here, sir? And he said, this is my patient. And I said, not anymore. And he was like, well, I would like to know what your problem is with me. And I said, I will gladly tell you what my problem is with you. I said, I was up here earlier with him. You did a urine analysis, you didn't do a chest x-ray, and you didn't do any blood work, even though I told you that when this happens, 99% of the time, it is because he has pneumonia. And he tried to argue with me, and I said, if you don't get the actual F out of this effing room, I am going to call the police on you. I said, I want a new doctor. And my coworker just looked at me in awe, in shock, and was like, F yeah, bro. High-fived me. And I was like, I'm going to stay until they get him a new doctor. Once they get him a new doctor, I'll go. And he's just in the hospital bed looking so just ick because he's not feeling good. And I gave him a hug and he just goes,
no.
Because he used to do kisses on the cheek like that and it was adorable. But yeah, so that was an instance where I had to advocate for my resident because he wasn't getting the proper care that he needed. So yeah, if you gotta be a bitch, you gotta be a bitch.
Yeah.
I think ending points.
I mean, continue to advocate for your patients if you're a caregiver, or just in general.
Mm-hmm.
Family members, friends, advocate for yourself.
And if you can't advocate for yourself, make sure you have someone that can if you become incapacitated.
Mm-hmm. And we will continue to advocate for caregivers because at the end of the day, caregivers really don't have anybody to advocate for them. We've talked about this many times. The whole reason we even started this podcast in the first place was to advocate for caregivers because a lot of them don't have a voice because they're too busy using their voice on somebody else.
Yep. We're notorious for ignoring ourselves and caring about everybody else because it's literally in the job title. Caregiver.
You give care to others.
Mm-hmm.
You don't usually give it back to yourself.
No, because you're exhausted from taking care of everybody else all the time. Just is what it is, man.
Correct.
However, we have been getting better about self-care because we have to at some point. I can't tell you how many times I've burnt myself out and just not felt human for months on end because I was literally just working myself into the ground. And while it is a rewarding job that I love to do, and I love my residents, every single one that I've ever worked with, even the ones that I say I didn't like, I liked. I liked at some point.
Right, exactly.
Like, they all have bad days. It's just...
We all do.
Everybody has bad days. And at the end of the day, no matter how bad the day is, it can't be bad enough to make me, like, hate any of them. Ever. Yeah. Ever.
You know, I'm learning that there's a lot of things that are self-care, even if they don't seem like it.
Mm-hmm.
You know, like, just for example, kind of a goofy example, but last night I went out and I bought myself some new underwear, some new bras, and some underwear for my husband. And it's like, there's just those simple things, like, you don't think about, like, you know, for me, in my traumatized brain or whatever, that's, like, a huge deal. Like, you don't just go out and do those things. You have to have a reason. But no, you actually don't. You can just
go.
You could just go. You could just, like, buy... You can replace stuff whenever you want to, just because. And that really is a form of self-care. Just, like, learning that you could do those things for yourself.
Like, hey, I don't have to wear underwear that have holes in them. I can go out and buy new ones.
So you know what? Take care of yourself. Advocate for yourself. And buy new underwear.
Buy new underwear. Don't forget to wash your ass.
That's a throwback.
That is a throwback.
Okay. Well, since I do the shameless plug, you can do the other thing.
Okay, other things starting. You can find us on Facebook and TikTok at Boss Ravioli Queens. You can also email us, bossravioliqueens@gmail.com. I know that we just talked about changing all of our socials and stuff possibly. We don't have to do that. We just changed the passwords and now we're good. So you can still find us in those same locations. Also, don't forget to hit the like and subscribe buttons and the notification bell, because who doesn't want to get notified when their favorite caregivers post a new episode? Right? Yeah. So until next time, guys. Bye! Oh, shit.